How can someone know when they should have surgery for their back pain?
That's a good question. And I think it's not one that should be, or surgery isn't something that should be entered into lightly, I don't think. I usually think of sort of three categories. So instances where back surgery is probably warranted, instances where maybe you should be considering back surgery, maybe it's a good time. And then I would say there's also times when surgery probably shouldn't really be what you're thinking about or contemplating. And so I would say the situations that would warrant back surgery and where back surgery is probably your best option, there's three of them that I can think of. One would be if after your back pain started, you've also noticed that you can no longer control your bowel or bladder function. So either you're going to the bathroom when you don't need to be, or you're not going, or you can't go when you're trying to go. So that would be the first one. The second one would be if you've had some sort of significant trauma that's resulted in broken bones and significant damage to the ligaments or the bands that hold your spine together, then you might need someone to go in surgically and sort of hold you back together again with some sort of devices. The third one I would suggest is if you have a cyst growing in your spinal cord that's applying pressure to your nerves, then someone would have to go in surgically and remove that cyst to help with your pain. So those are the three I can think of, the three times when you might want to have back surgery, or back surgery might be the best option. Now, when to consider back surgery, when it might be a good option. So I would say there's a few factors here. So if you've had back pain for 3 to 6 months, at least, and that pain is constant and unrelenting. So it doesn't matter what you do, it's always the same, it hurts like crazy, it always hurts, everything you do hurts. And if you've also tried virtual surgery.
What's virtual surgery?
Yeah, so virtual surgery is when you pretend you had surgery, but you didn't, and so then you follow up your virtual surgery with the type of recovery or rehab you would do if you actually had real surgery. Mm-hmm. So you don't need the surgery, you just need the recovery or the rehab following surgery. So you'd start your first few days off doing very little, mostly rest, maybe slight walks, just things like that, no heavy lifting, all these sorts of things. And then over time you would increase how much you're doing, what you're doing, to give your back a chance to basically desensitize or to feel better, for the pain to go away and then to slowly rebuild it, to be able to withstand the forces you put on it. Because we think that for a lot of people, the benefit they get from back surgery is probably, or could be more related to the forced rest they're getting than the fact that they actually had someone cut them open. So I'd say those are the three factors for when you might want to consider back surgery. So you failed virtual surgery, your pain is unrelenting, always there, and you've had it for 3 to 6 months. And now when you should be considering back surgery, at least not yet, I would say the intensity of pain does not indicate whether or not you need surgery. So even if your pain is extraordinarily painful, that doesn't mean you need back surgery necessarily. In most cases, I'd argue it doesn't. And the second thing would be that if you have good and bad days or good and bad times, or your mornings are better than your evenings, or your evenings are better than your mornings. So if your pain changes in some way, then I would also suggest that means back surgery is probably not for you, at least not yet. So in that situation, I would suggest what you need to have someone do is show you the cause of your back pain and how you can avoid the cause of that back pain. So figure out what your pain trigger is, basically avoid that pain trigger, helps your back feel better, the pain decreases, and you are able to do what you have to do without having back surgery. And that's what we like to do here at this clinic. We like to help people figure out what it is that's causing their back pain, show them how to avoid it so that they can get back to a hopefully pain-free life and being able to engage in their chosen activities.